Welcome to this training session on the Ilara HMIS. The Ilara HMIS is a digital tool for streamlined clinic operations, meaning that your facility is acquiring it so that it can help in the documentation of patient encounters. It will also help with billing and inventory management, and ultimately it will help the facility to scale in regards to improving the patient care and also improving patient retention. The system has additional features that supplement and also help it easier to manage the facility and also to grow the facility and help it succeed. Now, the Ilara HMIS is a web application, meaning that to use it, what you need is access to the internet, and also you'll need a web browser. The system works on any device that supports a web browser. You could use it on a desktop, laptop, or even on a mobile phone. To access the system on the web browser, you'll enter the link to the system, which is HMIS. So the Ilara HMIS, the link is HMIS, meaning Health Management Information System. So the link is hmis.ilarahealth.com. You'll put that into the web browser and you'll get to access the login interface for the system. Now, the login interface requires you to enter your username or email and the password. For the first time login, you'll enter your username, which will be provided by us, and then you'll enter the default password that we had provided. The system will prompt you to change that password for security reasons, and then you'll be logged into the system. The Ilara HMIS is very user-friendly, and it's structured in a way that helps you have an easy time to learn how to use it. What we're seeing right now is a email verification notification and also a pop-up requiring us to enter our email address and verify it. This is a process that we've captured and outlined in a separate video. The link is shared. For now, we'll just close it. Now we are in the Ilara HMIS logged in. We want to first see how the system is structured to understand where we can go to access the things that we need. Now, on the left hand side, we have the menu of the system, which can be opened by this icon so that we can get a bigger menu with now the text labels added. So you can see these are the modules of the system. At the bottom, we have these two modules that we're going to look at. At the top right, it will have the detail of the person who's logged in and their job title. And this is the place where if you wanted to log out, you'll click on sign out. Or if you wanted to access details about your account, you can go to my account. We want to focus first on the two modules at the bottom here. These are the modules that can help you get help when you need it. The first one is the support form, so we'll open it up. The support form allows you to contact us, Ilara Health. It could be you want to send a feedback message, you want to request for support, or you want to report a bug. So how you do that? You'll enter the facility name. This is the name of your facility. You'll enter your email address. Then you'll pick the type of message you want to send us. It could be a bug, feedback, or support request. Bug means the system is not working properly and you want to alert us or even share how the system is behaving. Then on the description, you'll type the description of the message you want to send us. And what we advise is, we advise that you add your mobile number so that we can contact you quickly and much more easily compared to contacting you through your email address that you've provided up here. You can upload a document that can be a screenshot or media showing how the system is behaving. With this filled out, you'll click on submit, and this message will reach us, and we will reach out to you to offer the help or acknowledge the feedback that you've given us. The other module is the help center. Here we'll open it up. So the help center opens up the Ilara Health Technical Help Center, which has the products that Ilara offers and help materials related to those products. So when you reach here, you'll pick Ilara HMIS as the product you're interacting with to get the help materials for the Ilara HMIS. Now we are here and we can see they are organized nicely. We have the search for answers field at the top that can help you get easy access to the materials, or you can access them through the navigation buttons on the left here. What I want to show you is the getting started to show you how these materials look like. So on getting started, we have the Ilara HMIS user guides, which when you open up brings you to now specific guides for the Ilara HMIS. We have the first time use guides, and then guides based on functions or sections of the system. So for first time use guides, for example, you'll click on it to open it up, and this will bring a document that has the guides, so you can see accessing the Ilara HMIS and logging in for the first time. If you were to open this up, it will bring you the step-by-step guide on how to do that function. So if you want to know how to access the system, this is the guide that will show you the link of the system. It will tell you that you'll be asked for your username or email and the password. Then we want to go back to the other sections. These ones, if we wanted to look at billing, it will also have the list of activities that we can do on billing. So we can create an invoice, and if you open it up, it will show us the step-by-step guide on how an invoice can be created in the Ilara HMIS. That's that on the help center. It's a place that you can also get frequently asked questions and their answers. So back to the HMIS. We want to now see how the facility admin can set the system up for the first time use. So it's the facility admin because that is most often the user account that is created for the first time when the facility is coming on board onto the Ilara HMIS. So the first person to have access to the system needs to prepare it out for the rest of the other users that are going to use the system. And those are now the admin functions of setting up the system for first time use. And that's what we are going to look at. When your facility acquires the Ilara HMIS, the admin needs to go to the admin panel to set the system up for first time use. On the admin panel, the admin will first verify that the organization details that were provided are correct. If not, then the admin will change them. The admin will also upload a facility logo if available, because this logo will be available in the documents that will be created. So it's good to upload it so that the documents will have the facility logo. Then on payment methods, here the payment methods will be added to reflect the payment methods that the facility accepts. So on payment methods, you'll click on add payment method, enter the name of the payment method. If it's M-Pesa, mark it as active on POS. This means that it's an active payment method that can be used. It's selectable at the point of processing the payments. and then collect transaction code indicates that this payment method will require transaction code to be entered for a payment to be processed with that specific payment method. Then you'll click on confirm, and the payment method will be added into the system and displayed in the list, as you can see. With the payment methods added, the admin will scroll to organization roles and permissions. This is where the admin will set out the level of access for different user roles that the staffs are going to have. So here, the step is to first select the user role, if it's, for example, a cashier, and then specify the level of access a cashier should have, where on that we have the specific area of the system, that is the permission, and then we have access to create, edit, view, or archive. Now, to grant an access, for example, if we want to grant a cashier access to create broadcast messages, we will do that, and then we will also give them the access to edit and also the access to archive. Archive in the system is used in place of delete, so it represents the delete function. It is used because delete purely is not supported in the system, because one record created can have multiple records attached to it, and deleting one record will mean also deleting the child records that are linked to it. So the archive function is used in place of delete. So that's how the roles will be granted. And then the admin, if wants to move to another role, will just select another role and apply the role's permissions that he wants or she wants to set out. Good to note that you'll need to save changes to apply the changes that you've entered. So you'll click on Save Changes button at the top right to save the changes into the system. With roles and permissions set out, the admin will go to Staff Management, where the admin will create the user accounts for the rest of the staff that are going to use the system. Now here, to create an account, you simply click on Add Staff, and then you'll provide the information of that staff. Now, to add the staff, you'll start with providing the title of the staff, which will be Mr., Mrs., Professor, or Doctor. The title is required. Then you'll provide the other details, including the email address, phone number, the address. I'll talk about the role. So the role is what will define their level of access in the system. So here, if the role was a cashier, the level of access that that staff will have or that user will have is for the specified role. And you can click on View User Roles and Permissions to get a read-only access to the settings that had been applied for that role. So you can see that this particular role will have access to appointments, to view, edit, create, but not to archive. It's good to note that at this point you cannot edit these settings here. The settings are edited on organization settings, where we had seen how to customize those roles. Then the job title is not role specific, it is not access specific. So you'll pick a job title. It could be a medical officer who has the level of access of a cashier. And then on the username, you'll generate a unique username. What we recommend is the first name dot last name. So you could say Eric.Odhiambo. We do that simply because we would love the username to be memorable, and also we would love the username to have a format that somebody can pick out from, even someone's username, to remember their username. And then also it needs to be unique in the system, or else this account will not be able to be created if that username has already been used. And for the password, we will just enter a default password, This will be the password that will be used for the first time login. You just use a simple password. The user will change that password when they are logging in for the first time. With that done, we'll click on Save Changes, and the staff will be added into the system, and we'll be able to see them in the staff management section here. So the staff will be listed as one of the staffs here. This is the place where additionally in the future, if we would want to manage that staff, either to deactivate their account or change some information about the account, this is where we will come to. But now that we are looking at how to customize, how to set up the system for first time use, the account is created. Now what we're going to do is we're going to the next section to even specify more customization in preparing the system for use. And that next section will be on branch management. In the branch management, we will see the branch here. We will click on edit to check and verify and also update some information about the facility, including details like the services that the facility offers. Then we will look at receipt options to specify how the receipt should appear, where we will say that we can first start by previewing the thermal receipt to see how a thermal receipt produced by the system will look like. This is how it will look like. Then we can also preview regular receipt to see how it will look like. We can also add additional header information, including something like the M-Pesa till number, or a footer information, including something like saying thank you for your business. Then we will select the type of receipt the system should produce, if it's either thermal or regular, and also indicate if you would like the logo to be shown or not. Then we'll proceed to invoice options and do the same, where we will preview to see how it will look like. And we can also add additional footer information. Then we will indicate if we would like the business logo to be shown or not. And here we have invoice recipients, where we will add a new invoice recipient. So these will be the companies or individuals that we are going to generate invoices for. So it could be the insurance company. Here we add by indicating the name of the recipient, and then we indicate the recipient address, and we mark it as active on POS to mean that it's an active invoice recipient that can be selected when generating an invoice. Then we'll click on confirm, and that invoice recipient will be added into the system and added to this list. As you can see, we could even manage them later on if we would want to do that. With that, we are done with branch management. The other section that we need to set up for use is on the inventory stock management, where here we will need to add the products and services for the facility in the account so that they can be used to generate the bills and invoices. On this section, there are two approaches that we can take. One is that we can add these products one product at a time by clicking on the Add Product button, where you'll need to provide the product information, that is the product name. Like this, for example, we want to make sure that we describe the product in detail, indicating the product name, strength, and even the form, if it's a tablet or if it's a syrup. And then we will indicate the product type. This will be a product. We will add an SKU, which is a unique identifier for that product if we have. This can hold the barcode or even a unique number assigned to that particular product based on your operations. Then we will make sure that this product is categorized to the right product category, where we will indicate the product categories are on the system. So we will search and say if this is an antibiotic, we will select that. And then we will add the selling price for that product. The system uses packages, which are different forms that the product exists in that it can be sold at. and we will start by entering the detail for the base sellable package. So this will be the smallest form of that product. So if it's a tablet, we will say tablet, and we will indicate the selling price for that tablet. We will mark it as available on POS to indicate that it's active and it can be, that package can be selected at the point of selling that product. Then we can add other packages, something like 10S. 10S now has 10 tablets in it, and then we'll indicate the selling price for that pack and mark it as available on POS. We can even add packages that we do not use for sales, but we do use them for restock. For example, we could add a box and say a box has 100 tablets. The selling price is required, so we will need to add a selling price to add this package. Now, if we do not intend to sell these to customers as box, then we do not mark it as available on POS. So that's how packages work on the selling price. And then we will add low stock notification number. This is the number of minimum units that we expect to have at any given point. If the units fall below that number, then the system notifies us that that product is running low on stock and we will need to restock it. So we can put this at 25. With these details filled, to add the product, we will click on Save Changes, and the product will be added into the system and it will appear in this list of products. So that's the first step. The other way to add products into the system is through the use of a product list, as shown here. So this is a sample product list. This is how a product list will look like. It is just a spreadsheet of the product details. These are the product name, SKU, type. They're the same information that we were capturing on the system. But now this allows for an upload onto the system, making your work easier if you can fill out this product list. And this can be shared to your facility on request from us. With this, if you can populate this, we can upload it into the system and the products and services will be added into the system. Okay, so I've shown you how to add a product using this. I've also shown you how a product list works. The other section is how to add a service. So we saw how to add a product, although the same process applies, because the system will need to have the products and services. These are the billables that will be selected when creating the patient bill. So if a service is also to be added, it could be added on the product list template that we saw, or it can even be added as an individual item by clicking on the add product. The difference is that we will here now select service and not product. And when we do select it as a service, there are some other fields that are going to be removed. As you can see, we no longer have units, and we also don't have low stock notification. Because this is a product, it's a service, and a service does not have stock information. But still, we will need to enter the service name. If it's tooth extraction, enter the product category. So if this is a procedure, we will search for procedure and select that category, and then we will add the selling price. And the same process also applies where we could have this product offered to a minor for 700 shillings available on POS, or it can be offered to an adult for 1000 shillings available on POS. So packages allows you to define different price points based on how you will decide to name your packages. It could be even based on the payment method that will be used. Now, with the details provided, we'll click on Save Changes and the product will be added into the system and it will appear on the list. So this will be the place where Inventory management will be done, doing things like restock. Now we've seen how to add the products. If you wanted to restock the products in preparation of the system for use, we will go ahead here and we can locate the product from the list, or we can search for the product using the search field. And what we will do is to click on the three dots and then click on restock if we want to restock the product. The system will ask us for the package. It will ask us for the buying price per package, and also it will ask us for the expiry date of that batch that we are restocking and the packages to add. And we'll click on add items, and this will update the units that are now available in the system. We recommend that this is a process that needs to be done before the facility starts officially using the system, because if you will then do sales without updating the stock levels, then the system will be deducting the units to negative, and that's not a good sign of a proper use of the system. With that done, now we can say that the system is ready for use, and we can now go to the next part. We click on back to EMR to see how now we can document a typical patient encounter on the system. When you're logged into the system, again, based on the role that you have and the settings that have been done on the admin panel, you could be either having access to some modules or not. So if at all when you log in you don't see some modules, it's not that the system does not have them, but it's because your particular role as of that time does not have access to seeing those other modules in the system. On the modules, most of the time when you log in, you'll be logged into the dashboard, and the dashboard is the first module there. And what it has is that it gives us information about how your facility has used the system, indicating statistics like the total patients that have been registered and also total encounters that have been recorded. And it also informs us of the same number for that particular day. So how many patients have been registered for that day and how many encounters have been recorded. You will see a disparity in the numbers because patient registration only happened once, and each time the patient visits the facility, they are created for an encounter for that particular day. That's why this number is higher than this, because there are patients that have visited the facility multiple times. And then on the dashboard, we also have the waiting room, which has encounters, which will be the list of patients that are queuing for services. They'll be listed here, and again, it will be arranged based on first come, first serve. And then we have the priority list, which will have patients whose triage has been marked as urgent or emergent, indicating that we need to prioritize care to these patients before we look at the others. And today's appointments will have the list of patients who had been booked for an appointment for that particular day. When a patient visits the facility and the first contact person, most probably the receptionist, attends to them, that person will be logged into the system. And what they'll do is that they'll go to the patients module to access the list of already registered patients and to search to confirm if that patient already exists in the system or not. So you'll provide the patient name or phone number to search for a patient. If the patient or patients with that name do not exist in the system, you'll be notified like that. If the patient exists, then you'll be able to see the list of patients with that patient name, and you can confirm based on the phone number or even the details like the age of that patient to identify that this is the specific patient that you are attending to. Now, if a patient does not exist in the system, then you can go ahead and register that patient by clicking on the new registration button We recommend you search first, because we do not if you do not search first, then there could be duplicate registrations of the same patient in the system. Now, when registering the patient, you'll provide the required details like the first name, last name, the gender, date of birth, the patient status. You'll also provide the phone number, a very key field. It's a required field because you'll be able to see this system sending out SMSs to the patient's phone numbers later on. So the phone number will be required to register this patient. And then these other ones are optional. You will also indicate how the patient heard about the facility. This one is helpful in getting to track the marketing initiatives and also the results that they are bearing. This will guide the facility on the source of patients, and that can help to identify trends that could lead to acquiring more patients or to retaining those patients. So we'll pick an option, and then patient identification, patient number is optional, and then the physical address, county and sub-county is required. The next of kin information will be required if this patient is under the age of 18. But if the patient is over the age of 18, yes, it's recommended to get the details of the next of kin, but it's not required if the patient is over 18. And the system will be able to know the age of the patient based on the date of birth that you had provided. With the details correctly filled, we'll click on Save Changes, and the patient will be added into the system. They'll be added at the top of the patient list. You'll find them at the top here, where now, as the first contact person with the patient, we can proceed by either documenting the patient consent or by even adding a patient tag to that patient. Now, patient consent in the system is a way on how the Ilara HMIS helps your facilities comply with the data privacy and protection laws, which require that the patient needs to be informed that their details will be stored digitally, and their consent needs to be processed on the system. So to do that, you click on Data Consent. The system will send an OTP code to the patient's phone number. That's a short one-time password. Then you'll mark that the patient has given the consent to have their medical information recorded, and also that they've given the consent for the use of de-identified aggregated data for analysis, meaning that their personal identifiers will be isolated from the data when an analysis is being done. And then also that they are consenting that you, as the care provider, may contact them to participate in patient benefit and clinical research initiatives. Then they'll read out the code and you'll enter it here, and then you'll click on Confirm and Save. If you're not able to process the patient consent at this time, you could always click on Proceed without OTP, and that will mark it as pending so that you can complete it later on. On patient tags, you can start adding the patient tags. These will be identifiers that could help the people attending to the patient get to identify some useful information about the patient, like the payment method that patient is using. To add a patient tag, you'll click on Add Tags. You will choose the tag category, if it's probably maybe payment method, medical condition, or medical programs. So let's pick payment method, and then we will select the payment method the patient is using, and we can add a tag description of that payment method and click on Add Tag, and the tag will be added to that patient. Patient tags, other than helping give out some critical information about that patient, they are also a way of clustering patients into patient groups that can be used for things like message broadcasts in the future, or just getting to understand the specifics about particular patients. With that done, what we will do next is to create a new encounter, because the patient has visited the facility and now we want to document that patient encounter digitally. So we'll click on new encounter, which will ask us to assign a doctor, and we have the option to backdate the encounter, because currently the system automatically selects the current date and time of that encounter. But if you wanted to backdate an encounter, this is the place you'll use. You'll just click here and pick the encounter date and time. Then we'll click on start new encounter. The encounter is created, and right now we've been redirected to the encounter list, and the encounter we just created is at the top of this list. The patient now moves to the next station, which is triage. And here we're hoping that the triage person is also logged into the system. They're waiting for the patient. The patient will identify themselves with their name, and the person will be able to identify that patient in the waiting room. And then they'll click on 3 dots and click on resume encounter, which will now open the patient encounter. The patient encounter has been built to ensure that it's very user-friendly, easy to use, and also while still maintaining a structured way on how you can be able to document the details of that patient encounter. Now, on the left-hand side, we have navigation buttons that can help you move from one section of the patient encounter to the other, and they're arranged based on the typical flow that a normal encounter will take. That means it will flow from triage, complaints, medication history, examination, all the way to when the patient will be billed and the encounter will be closed. In the middle, we have the selected section. So if it's triage, we are on triage. And on the far right, we will have patient overview, which informs us that the open patient encounter belongs to this patient, and we even get their biodata there. We will also see the tags that had been added to that patient. Here we have the triage, which will have the last taken vital reading for the different triage category. And also we will have the encounters part, which will have the most recent pre-encounters that that patient has had. From here, we're able to see the information of the patient encounters, like the dates, the doctor that saw that patient, and even the encounter type. If we wanted, we could click on view all to see all of the encounters that patient has had. On history, we will have allergies, medical or surgical history, and family history. This one we can view if they had been added, or we can add them if they still had not been added. This section of the patient encounter, the patient overview, is not useful most of the time, and so to conserve space, you can always click on the hide button to give you more space to do the actual work that you need to do on the patient encounter. Now, the patient is on the triage section. The person on triage is going to take the vital readings and enter it into the system. And how that happens is that the readings will be entered, like the weight. We can enter the weight here and say a weight of 56 with the height of 172. And we can pick the patient status as stable. Now, while we're here, if you pick the patient as urgent or emergent, the patient status, then this patient will be moved to the priority list that's in the waiting room. So we'll pick it as stable, save the readings, and you'll see the readings have been added, and the system has even calculated the BMI of that patient. Now, on trail audits, you're seeing that the system records the date and time the readings have been entered, and that the system also keeps track of who's logged in using the system, who's entered those vital readings. Now, triage can be done as many times as you want. You can always go back here and enter some other readings for some other vital for that patient and save the readings. We will proceed to complaints and HPI, and the assumption is that the user that's now going to look at this section would have resumed this encounter either from the waiting room or from the dashboard. Now, on complaints and HPI, the first field is selecting the encounter type. So at this point, we know the reason the patient has visited the facility and the specific type of the encounter. So we'll select it from the list. This one will say as consultation. And we will say if this is a follow-up review or not. If it's a follow-up review, we will say yes. If not, we will take on no. We will also answer if the patient has been referred from another healthcare unit. So the system is tracking referrals, and if you say yes, it will ask you for more information about that referral, including details like where they were referred from and why they were referred to your facility. So let's say no. The system allows you to upload documents or attachments, and these ones, when uploaded, can always be downloaded at a later time. Then we will add the patient's complaint. How we do that is that we start with the patient complaint or symptoms field, where we will select the complaint. So there's the list of complaints that's in the system, as you can see. This allows us to search and quickly select the patient complaint. Like if we wanted to say the patient is having diarrhea, we can see diarrhea is here, and we select it, and then we will specify for how long. We can say 4, then select for days. And comments are optional. If you wanted to save, you will click on save complaint, and it will be added into the system. For complaints that have not yet been preferred into the system, like these ones we are seeing here, what we will do is that we will select the other complaint. So we will search for other and select it. And when we do select it, it activates this other complaints field, which allows us now to type the complaints that we want. So we can say here we have the liberty to even add a chain of complaints. So we could say joint pain, and severe migraines, for example. And then we will specify for how long those complaints have been there. So we'll say 5 days. Comments are optional. We click on save complaint, and it's added into the system. So that's the process for adding the patient complaints. Then on the HPI, which will hold the history of presenting illness, it's an open field. We will enter any notes that we have or any details that we would like to capture in this field. This one automatically auto-saves, so as you type, the system will be saving what you are typing there. Then moving forward, we have structured visit forms, and these ones make it easier to offer the best patient care by having already the anticipated questions that needs to be asked in those specific visits. And it also allows you to be able to track specific visit types in across the duration that they're in. So for example, with the family planning, you'll already get the questions already captured, and allows you to be able to select the answers, making it easy for you to document that specific visit type much more better. And it also saves time and makes sure that you do not miss on asking a very essential question as per that visit type. Then this is also gender specific, so visit forms like ANC and PNC will not be available for male patients, but family planning and tuberculosis will be available. Then we proceed to review of systems, where we have the general constitutional review, where we will select what applies. Then we have the systems of the body, and we can open up and pick the information that we're getting from the patient in regards to that particular system. So on ENT, the patient could say they have a tooth pain. Then moving forward, we have medication history, where we will have the pre-medication entered. So this is the medication they took before the visit. We will capture it here and save it, one medication at a time if the patient had multiple medications. Then we proceed to examination, where we have nutritional assessment, general examination, and examination of systems. And it's even easier to document it. So we saw that on ENT the patient said they had a tooth pain. After examining, we can be able to say we've identified dental cavities. Then we proceed to investigations, laboratory, and this area is tied to the diagnosis section, which is the next. So it indicates that to use this section, we need to add a diagnosis. So what we do is that we'll go to the diagnosis and plan section and add the differential diagnosis that we have already, where we will say we are anticipating that the patient will be having this diagnosis. We select it. How this area works is that the system uses ICD-10 for diagnosis, which is the international code for diagnosis 10, and it is divided into two parts. We have the quick list and the full list to make your work easier. The quick list has the common diagnosis at around 170, and the full list has the entire list of the ICD-10 diagnoses at around 70,000. So to quickly select a diagnosis, you can search for it in the quick list. If it does not exist here, then you can go forward and select it in the full list. You can also leverage on Google to get the diagnosis code and then search for the diagnosis using the code. So the process would look like, I will go to a new tab and say I'm looking for ICD-10 code for arthritis, for example, and then I'll be able to identify the code, copy it, take it to the full ICD-10 list and enter it here, and the system will return that diagnosis, and then I'll be able to select. So that's a much more enhanced process for you to do the diagnosis selection. With the diagnosis selected, now we can go and use the laboratory field, where in the laboratory field we have the search by department field, which has the list of available investigations in the system, as you can see. And this one allows us to select, to search and select for the investigation we would like done on the patient. So if we wanted hemogram done, we will search and select it. We could search for another one, or another way of identifying the investigation and selecting it is through the view available investigations section, which allows you to see these investigations categorized by their department. So we have the hematology department, and we can say from here we would like this particular test to be done. And in a situation where you miss an investigation that's not in the system, you've searched for it and you've not found it, it means that we have not yet added it. And in that case, you will use the other investigation requests field and type out that investigation request. The request notes allows you to communicate with the lab tech by typing in some information. And then you can click on request investigations to request them. The request has been added in the system with the date and time, you can see. To enter the results, the user will click on that investigation request and then open up the specific investigation. So if it's malaria, open up the specific investigation and enter the results, where we could say so, and then save the results. Now, the Ilara HMIS makes it easy to handle the investigation process by having structured forms for the entry of the results, where the system was already identified and captured the parameters, the units and the ranges, and allows the lab tech to just enter the result value. So this makes it easy to enter the results, and also it makes it easy to digest the information or to view these results once they've been posted. So you'll click on Save Results after entering the result readings to add the results into the system. That's the process for entering the investigation results. The system also has the imaging section that's almost similar to the laboratory section. It also has the list of investigations in it, and you could search and select, or you could also click on View Available Investigations and select based on the department. Good thing here is that when you select an investigation, you are able to upload a document into that specific investigation. Something else in this section is that it allows you to generate lab request. So you could click on the three dots, click on Export Lab Requests, and you'll select the specific lab request you want exported, and then you'll click on Export and export to generate the lab test request form. So this is how it will look like. It will have the details of the patient and the details of that request. Moving forward, we'll go back to the diagnosis and plan section and look at the other areas. So the diagnosis and plan section here, when we do come back now with the results from the lab, we can now tone down to the specific diagnosis that that patient has by eliminating the other diagnoses that are now not positive. So we will remove these if the patient is now confirmed does not have that specific disease, or is not supposed to have that diagnosis, and then we remain with the diagnosis that applies. Then we proceed to treatment and plan, where we can add nutritional advice or additional care instruction. We can also generate a referral request. If we are referring the patient to another facility, we can document that and generate a referral document by filling in the information that's needed, and then we will save it and generate a referral document. On sick notes, the system allows you to generate sick notes. You'll specify what the person is excused from, the reason, the duration of the sick leave from this date to this date. Save the sick note and you can download it and print it out. Then we go to prescription, where we will prescribe medication to the patient. How we do that is that we will enter the name of medication, select the formulation, enter the dose, frequency, route, and duration. So how that goes is that we could say AL tablet 24 twice a day, oral for 3 days, and save it. With the prescription added in the system, you can edit it out if you want to change some information, or you can click on Export Prescription to generate a prescription document that you can download. With that, we'll proceed to the other section of the patient encounter, which is appointment schedule. Appointment schedule allows us to book appointments for this patient by clicking on Book Appointment, where we will specify the reason why the patient is to come back to the facility, the date they are to return, and the reason comments. So we will add some comments there and click on Book Appointment. The system allows you to book and add another if you are booking multiple appointments running across specified duration. And this is very useful because the system now, with the appointment books, the system will send an SMS reminder to the patient's phone number a day before the day of the appointment. This helps patient not to miss their appointments, and also it helps the facility to be able to track these appointments much more better. Then we will go to patient bills, where we will bill this patient, open the point of sale, where we will be able to access the products and services that had been added in the admin panel, as we had seen. We will search for them on the search field by their name or by their SKU. So to search by the name, you'll type the name of the product. You'll select the product package. So you're seeing the different packages of that product. If you want to sell 10S, we will click on add to add it into the order summary. If we want to add another product, we could search and select. And add into the order summary. That's the process for adding. At this point now, we could change the price if we want to either offer a discount, or if there's a wrong pricing, or if there's a markup or service charge. If not, we can either complete the payment if the patient is paying for this amount, or we can generate an invoice. So to generate an invoice, we will click on the icon here. To complete the payment, if the patient is paying, we will click on complete payment. So let's assume this patient was paying for this amount. So we'll click on complete payment, select the payment method, if it's cash or M-Pesa. If you select M-Pesa and it had been marked that it needed the transaction code, you see it marks this as a requirement and you cannot proceed without entering the transaction code. So we'll enter the amount. Let's enter the percentage, 100%, and then enter the transaction code. Click on validate payment, and that transaction has been recorded. If you wanted to print the receipt, we could have selected the print receipt option that was there. This transaction has been recorded and it can be accessed on the payment history, where you'll be able to see that transaction. It's been fully paid. When the patient has been fully attended to and is going back home, what we will do is to close the patient encounter to indicate that we are done with the patient, and that when we do close the encounter, we are not intending to do any amendments to the clinical notes, and also that once we close it, we can still be able to review that patient encounter in the patient encounter history page. And also that for new visits, we will create a new encounter to record the details of that interaction. The system is able to send a follow-up message if we select an option here. And the follow-up message is just a message that is sent to the patient's phone number, informing them that we are grateful they chose our facility and that we are checking up on how they're faring, and that if they have any concern or question, they can reach us on the facility phone number. So this follow-up message can be sent tonight or after 3 days. So we'll pick an option from what's displayed here. So we'll say tonight and close. If you do not pick an option, the system will not send the follow-up message. With the encounter closed, it will be removed from the waiting room. We see now we do not have that patient queuing for services. Moving forward, what we will do next is to generate a medical report out of that encounter, and how that can be done is to go to the encounter list. This was the patient whose encounter we just closed. So we'll click on the three dots and click on encounter history. This is the encounter we just closed, so we'll click on view summary to view its summary. So the encounter summary will look like this, and it's the medical report that can be downloaded. So you can export as PDF. It will have the sections of the encounter and the details that were captured. So we had the patient having diarrhea and joint pain, and they had malaria as the diagnosis. If you do not want a specific section to be displayed, you can always remove it by unselecting it. This allows you also to indicate that you would not like all parts to be shown, and then you select the specific part that you want to be shown. So for example, you may be interested in just viewing investigations if you wanted to print the lab results. And then you'll click on export as PDF. You can either save it as a PDF or print it out on a printer. Then back to the system, we will look at schedule module. The schedule module will have the list of booked appointments. This allows you to be able to identify day by day how many patients are anticipated to visit, and it can help you also be able to reschedule an appointment or cancel an appointment. Or from here you can also book an appointment for a patient. You'll search for the patient, pick the reason, enter the date and the comments. Then the messaging module that's next in the list of modules is a module that allows facilities to send broadcast messages to their patients. How this happens is that to send that message, you'll click on new broadcast message, and the system will require you to select the patient group, which can be either all patients in the system, or you could create a specific group of patients that you'd like the message to be sent to. Now I'll stop there to show you how a group can be created before we proceed. To create a patient group in the system, you will click on create a group here, and then you will type the name of the group, where we could say we want asthmatic females between 18 to 25. So then we will indicate the filters the system needs to use to identify these patients, where we will say we want patient tags, medical condition tag that says asthmatic. So the system needs to look for patients with the asthmatic tag, and also it needs to look at the biological data and only select female between the age of 18 to 25. And then you'll click on continue to select patients, and the system will display the list of patients that meet these criteria, and you'll click on add patients to group, and they'll be added into that patient group, and that patient group will be created. With the patient group created, you'll click on new broadcast message, and you'll be able to see it at the top here, where you'll be able to select it as the patient group. The system will inform you of how many patients are in that group and how many unique phone numbers exist for those patients. Then to send the broadcast message, we will type the title of the message. It could be Happy Easter Holiday. And then we will type the message that we are sending to them, wishing them a happy Easter. And what we advise is that ensure you have your facility name as part of the message content. So you can say the name of the facility, let's say facility name wishes you a happy Easter. So this helps the patients identify where the message is coming from, because the system usually sends the messages with a short code. It will not identify, for this particular message broadcasts, it will not identify the facility name. Facility name will be identified in the other automated messages like appointment reminders, follow-up messages, but not broadcast messages. So ensure to add your facility name as part of the message content. Something else is that you can schedule this message if you'd like to send it later, but if you wanted to send it now, you will proceed to click on send. But the system uses credits to send messages. It's 1 credit for 1 message, and the system will show you the available credits, meaning this is the number of credits you have. It will also tell you the cost estimation, representing how many credits will be consumed if you send this broadcast message. If you're not ready to send it, you can also save it as a draft, and it will be added to this messaging section as a draft, and you can send it at a later time. So for now, we will not send it. We will just click on the X. We don't want to even save it as a draft. This module is very useful for your facility because it can help you be able to do broadcast messages, including marketing messages, inviting patients for things like medical camps, also inviting them for some benefits like discounted prices on services or products, or you could use it to inform specific patients some specific useful information that you'd like to pass out to them. Moving forward, we will go to the billing module, which will have the point of sale. The point of sale allows us to do billing functions out of the patient encounter. We had seen how to bill a patient while in the patient encounter. Billing can also be done out of the patient encounter in the billing module. To do that, we will need to first add the patient to the bill. This is the person who we are billing, where we have the option to select if it's a clinical encounter or to indicate if it's an over-the-counter. I'll demonstrate on how an over-the-counter transaction will be handled. Over-the-counter transactions will be done most of the time at the pharmacy that's also doing over-the-counter sales. Because the system is tracking the inventory levels, it's best if the pharmacy also uses this section to ensure that the units are always accurate. So the person at the pharmacy will need to search for the patient, assuming that that patient buying the medication on that day was a previous patient that had been seen at the facility through a clinical encounter. So the first step will be to search for that patient using their name. If they do not exist in the system, then we will register them if we are able to get their details. And again, we understand that it's not easy to get the patient's details all the time, but we advise that if you can get the details, it will be best, because capturing the patient's information allows the facility to build up on a database of clients that it can leverage on through the functions like the bulk messaging that we just saw. It also allows to identify who that specific client was, who bought those medications, for a situation where there could be recall of medication that's done, or just for a trace on who purchased that medication. Although we understand that sometimes it's not possible to get these details, we recommend a workaround for the facility where the facility will register one patient, and that will be done just once. So the facility will register a patient that will be used in that situation, where we will say, put the first name, so that could be something like over-counter. So it's just an arbitrary patient. We ensure that we have a name that will help us be able to identify that's not a normal patient registered in the system, and then we will add the phone number of that patient, and then we will click on create over-the-counter bill to register that specific patient. This will be done only once, and then the next time we will search for them, where we will type over-counter, and we will be able to see that patient existing in the system and select that patient. This is because you are not able to create an over-the-counter bill without capturing who the patient is. So with this arbitrary patient as a workaround, it's possible to now create an over-the-counter bill without having captured or asked for the details of your patients. With the patient added, then now we can add the products, indicate the item they are buying. So we search for the product, and then we select it, select the specific product package. So if they're buying tablets, indicate the number of tablets, and then click on add. Then if we do not want to change the price, we will click on complete payment, indicate the payment method and the percentage or the amount that's being paid, and click on validate payment. But ensure to notice the print receipt option. If you want the receipt printed, you will check this and click on validate payment, and the system will print out the receipt. That is the process for creating an over-the-counter bill and documenting that transaction. Next, we'll go to the accounting section that has orders, where we'll be able to see first at the top, we have analytics into the billing data that's been entered in the system, where we will be able to see the total orders, total recovered revenue, again based on the payment method, total outstanding invoices, and total credit notes. Now, this part of the system is filterable. You can filter these totals and indicate the date range, where you could say you want these totals for the last 7 days, for example, or you could specify from which specific date to which specific date with the time also captured. And when you do apply that, now the system filters out and returns just the data for that specific period. So that's the first part of the orders section, the analytics part at the top. Then we have on the lower side where we have these tabs, the orders tab, all invoices, outstanding, past due, receipts, credit notes, and archive. The first part being orders, we'll have the list of orders that have been documented in the system. So these are the bills that have been generated or documented or created. You have the search field at the top, which allows you to search for the patient and locate their orders. You can export these orders into an Excel document indicating the date from and date to, and then you'll click on generate orders. You can also filter these orders by the bill type, if it's over the counter or clinical encounter, payment status, if it's unpaid, partially paid, or paid, and the date added, where you can specify the duration or enter the start date to the end date. Filters will be able to help filter out this. So we could say we want over the counter, paid, apply all filters, and we can now see right now we are only seeing in this table paid over the counter orders. To remove a filter, we'll click on the X icon back to the normal table. You can also configure the columns indicating the sections you want shown or the ones that you do not want to be shown. So for example, if you're not interested in the order date, you can have that removed through the configure columns. Now on the table, it's sorted according to recent at the top. So the one at the top is the transaction we just did, where we sold. We can check out what we sold by clicking on generate receipt and identifying the item that was sold, 25 tablets of diclofenac 100 mg. Back here, if this order had not been paid, we could add a payment. If an invoice had not been generated, we could generate an invoice. If it's unpaid, we can also add a credit note. A credit note will help us document and reduce the balance, where we could say we want to reduce bill amount by 300 shillings, for example. And why we are reducing it is that we are offering a waiver, and we update this bill, and that amount that was due will reduce by 300, and that credit note will be saved in the credit notes section. Now for those that are unpaid or even partially paid, we can generate invoice. To generate an invoice, we will select the invoice due date and then indicate the invoice recipient. So we can say it's due today, the invoice recipient is CIC. Generate the invoice so that we see how the invoice will look like. And this is how the invoice will look like. The all invoices tab will have the list of all invoices generated in the system, and you can search for an invoice based on the patient. You can also, on an invoice, add a payment, or you can click on the three dots to print the invoice, or you can void an invoice if it was not correctly created. Then outstanding and past due will list the invoices based on their standing, and then receipts will have the list of receipts generated from the system. Credit notes will allow us to see the credit notes that we've created, and on a credit note you can print that credit note. This is how it will look like. Then archive will have the archived invoices. They'll be listed here. Moving forward, we have customers, which will have the section where we will be able to see the invoice recipients and also be able to see how many invoices have been generated for them, how many days those invoices are overdue, and what's the total balance for that specific invoice recipient. And the system allows us to click on the three dots and either view the payer summary. This will list the invoices that are attached to that payer and the status and other information like the due date and balance. We could filter out this list. We could configure the columns. We could even indicate how many we want to be shown per page. Still, on clicking the three dots, we can also print the payer summary, which will ask us the payer summary duration. So we will indicate the start date and the end date, then click on apply, and the system will generate that payer summary. This will indicate the payer, it will indicate the invoices that are due that needs to be paid, the invoice amount to be paid, and balance due. With the training we have on the menu, the next module is reports. Now, reports has the external reports section, which allows the facility to be able to do MOH reporting with the support of the registers that are available in the system. That is the MOH 204B, 204A, 705B, and 705A. If you wanted to generate this report, you'll click on generate. You'll specify the date from and date to, and the system will generate an Excel document that's a replica of the physical MOH register. Now that will make it easy for you to transfer the data from that sheet to the physical register. Then we will go to the admin panel to see the other areas that we had not explored in the admin panel. So when we were here last, we were looking at how the facility admin can set the system up for use. Now we are coming back here to look at the other sections where we want to explore even much more further data analysis on the system. So we've entered some data in the system. We've seen how to do the entry for those data. But on the facility dashboard, we will be able to now get analytics all out of that data that's being fed into the system. So in the facility dashboard section, we have the summary dashboard, which is the first dashboard that gives us analytics into things like the patients, how many patients have been registered, what is the new patients registered number this month compared to the previous month, and it tells us if we've had a growth in new patients or a drop. So you can see we've had a growth of 66% this month. It will also tell us the number of encounters that have been created, how many encounters have been created this month, and again informs on the standing, if it has increased or if there's a decrease. It will inform of how many patients are return visitors and how many just visited the facility once. And also there is the patients total by gender distribution. So we can see how the gender of the patients that we have in our system have been distributed, and even the patients by their age group. So you can see that most of the patients we are attending to belong to this particular age group. And this kind of data analytics gives your facility insights that you can be able to use to be able to grow your facility or to make much more informed decision. Then you'll get the encounters by hour of day. This one tells you when you are seeing most patients and when probably you're having the lowest patient flow. So you can see that at 6 p.m. we've never had any patient encounter created at this time. So we've never seen any patient at this time. So as a facility, that information is very helpful because it can inform us to plan ourselves much more better. We then have the total encounters by visit type, and even encounters total monthly by patient's new registration monthly to tell us how does patient registrations look against the encounters that we are having. Then we have encounters by practitioner. Then we have top 10 diagnoses, where we are able to see the top 10 diagnoses, top 10 investigations, and top 10 inventory sales. Then the system also informs, we saw the part where during patient registrations, the system asks for how the patient had about the facility. So this is the area now where we can get analytics out of that data to be able to see how the numbers look, where we can see friend or family referral is the leading, and it's totaling to 27 patients across this period. And we can even see the breakdown by month. So January, we've had one patient say that they were referred from a friend or a family member. Now, this data that we are seeing is filterable. We can click on the date filter at the top here to filter this out, this data, and say that we want everything displayed here to reflect data entered in the last 30 days. For example, we could even specify from which duration we want the start to the end date to be. But when you do this, you are able to see the data now has changed, and it now only picks out analytics for the data entered in the previous 30 days. Then we have the revenue tracking, which has the analytics out of the revenue data. It tells us of how the bill total amount received. It tells us of the bill total amount monthly versus bills average revenue per visit monthly, and we can see the trend across the months. We can see revenue by the department. We can also see bills in counter versus over the counter, closed and open ones. We can see amount by department monthly, bills total count monthly by bill type, and even we can also see trends like amount generated by practitioner and even the received payments, informing us of the payments and who received those payments. Then we have the data completion dashboard. This one helps us know how best the facility is using the system by tracking things like encounters with diagnosis, investigation requests and results, and encounters with a prescription. So the system is trying to track to identify that the encounters that are being created are having a diagnosis attached to them. And now we can see the disparity where in a particular month like this, when we have 38 encounters with only 13 diagnoses, it informs that there's a very big disparity, and that could tell us that something was not right, which needs investigation to identify why not all the encounters had a diagnosis attached to it. Could it be that the user did not know how to do it, or the user was having a challenge, or potentially even a technical challenge? So it's worth looking at this dashboard, identifying trends, and following up on them to get them actioned. So the same with investigation requests with results. You'll be able to see the investigations that are being requested and the results that are being added. So when there is a huge gap, it informs something is not right. But when it's a close range, then it informs that things are okay. So that's that on the data completion. Other areas that we did not look at is the area that allows you to buy Ilara meds. That is a beta feature here. If your facility is part of the beta program, you'll be able to purchase meds from Ilara. So you'll simply create an order, specify the medications that you want, and complete that order. So we'll not look at that right now because it's a beta feature. We will go to the expenses section, where we will see how your facility can also record expenses for easy tracking, and also as a way of you being able to store documents. So this place can act as an archive for your expense documents like receipts or invoices. How that happens is that when you create an expense by clicking on the add expense and selecting the expense type, for example, drugs purchase, incurred by this user, amount, this amount, date is this, add expense, the system allows you to be able to upload files into this expense. And these files that you do upload, you can always download them at a later time. So the records will always be on the system, and that helps you not lose essential records. It also helps you get analytics into that data, because you will be able to, at a later time, come to the expense summary and be able to get the summaries where you can be able to see financial costs have costed you this much as a facility. And this data is also filterable. You can say you want this data to reflect for the past 30 days, and you want to see from this date then to that date how much has financial costs totaled to. That's that on expenses. We've now come to the end of the training session. You are now able to start using the Ilara HMIS, and as you pick up use, ensure that you do maximize on these support modules at the bottom here, because we guarantee that we are there to support you through your journey. Just ensure that you reach out to us when you do need help. That brings us to the conclusion of this Ilara HMIS training video.